Our muscles are not just muscles. They're also surrounded by this connective tissue called the fascia. And everybody that is a meat eater probably has seen it, like on a raw chicken breast. There's sort of that shiny, iridescent layer that's kind of really stuck to the muscle. So underneath kind of the fatty skin, and then there's this layer, and then there's the muscle. So that's the same in humans. We've got this fascial layer. It also permeates through the muscles. And guess what happens in our fight or flight nervous system? When that is activated, it tenses our fascia. And that helps our muscles to get temporary extra strength. And they've done this, you can do this, the fibroblasts, which are the cells of the fascia, you can actually do it in a little petri dish. If you give them some adrenaline, they go, it's pretty cool to see. You can also do it in the body. You can see that if you give somebody adrenaline, the chemicals of the fight or flight response, it improves their strength temporarily. And it does that by increasing how much the fascia squeezes around the muscles. So that's really good if you are, let's say, fighting off a mountain lion, like that guy in Colorado. That was his fight or flight nervous system giving him freakish strength temporarily. He couldn't sustain that, right? But it gave him a few minutes to fight off this mountain lion and survive. Well, in fibromyalgia, our muscles are continually fighting that mountain lion. And because we're only meant to be in that state for a few minutes, not a lifetime, the longer our muscles are doing that, our muscles and fascia are contracting, the more tight and painful and inflamed they get. And they've done some really interesting studies. One of my favorites is they took, you know, the pressure gauges, those needles that you stick inside your tire to see what the pressure is. You can do that with muscles, actually. So it looks a lot like the tire pressure gauge. So you can stick that in a muscle and see what the pressure is inside there. And they did a really fascinating study looking at fibromyalgia muscles, so, you know, in the trapezius muscle back there, compared to healthy controls. And they found a much greater pressure inside the fibromyalgia muscles. It was really tight in there. And that everybody with fibromyalgia is like, oh yeah, that's what it feels like. It feels really tight and tense. They've also done really interesting studies where they look at inflammation levels, not in the muscle tissue itself, but in the fascia, the connective tissue surrounding the muscle. And there's high levels of inflammation, and kind of, you can see that there's an immune response being activated in the fascia. And the fascia is actually a very pain-sensitive organ. So your muscle cells don't have many pain nerve endings. The fascia has a lot. The fascia has as much as our skin. So we have like a second skin underneath us. So there's our skin out here, and then there's kind of the fascial skin that surrounds our muscles. Super sensitive to pain. So there's all sorts of different flavors and styles of myofascial release. The one that helped me was the John Barnes approach to myofascial release. So what myofascial release is, what's different from massage, is that it's really prolonged stretching. So a myofascial release therapist will have their hands kind of here, this is called a cross hand release, let's say on your back. And they'll be really slowly over several minutes. It won't even feel like anything. They're spreading their hands apart. And there's a certain point where there's enough kind of pressure and heat built up in the fascia that then you feel this release. And it's amazing because that feeling of locked in muscles that is so common in fibromyalgia, that release is like the opposite of that. And it's truly, I feel like, the most specific targeted fibromyalgia manual therapy there is. And it's also really gentle. A lot of us don't tolerate massage very well. I don't know if any of you have fibromyalgia. If you get a massage, sometimes you'll feel kind of flared up or like achy or fluey. It just sort of seems to like anger the muscles a little bit more. I mean, there's all sorts of different massage, and some people will find like the right therapist, and it's, you know, I'm not dissing massage. Massage can be great. But typically for fibromyalgia, massage is something that feels maybe good at the time, but flares you up and doesn't give sustained benefit. And that's the difference with myofascial release. What's exciting about it for me is that you can get sustained benefit. It's not like something you have to keep doing over and over and over again forever. In Spain, they came out with 2 really big, beautiful studies on myofascial release. So in their studies, it was over 6 months, and the subjects got 24 sessions of myofascial release. I think the control group was like sham ultrasound or something like that. So they had significant improvement in pain, some improvement in fatigue and sleep, But the really cool part was they had sustained benefit at month 1 post-treatment and month 6. So 6 months after people's last myofascial release session, they still had reduced pain compared to when they started. So for me, myofascial release is what made the biggest difference as far as pain. It's what has continued to help me. I think I credit it with, along with getting sleep, with helping me to finish medical school, continue my training, continue working full time. At this point, I only really need tune-ups. I get myofascial release about once a month. I mean, I just kind of do it as needed. And then I do a lot of things myself. There's a lot of self-myofascial release that you can do because it's basically just kind of sustained stretching. And there are some really great online resources. You can find them at myofascialrelease.com, where they kind of, it's like online classes and they kind of teach you how to do some of these. Because if you can do if you can do 5 minutes of myofascial release on your own at home, A, that's a lot more cost effective, but B, you're going to be getting it consistently. And I really love just things as simple as, the trick of laying on a rolled up towel and you lay on the floor and kind of put your arms to the side. That can be really good for opening up this area. And I try and do that just for a few minutes every night because I do a lot of computer forward work. So I'm trying to kind of do that. And I have to really treat my myofascial system with great care.